Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a problem of middle age when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be manageable and much of the hair loss can be avoided. Today we have with us Dr. Manju M. is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS MD and specializes in dermatology, cosmetology, and hair transplant. She is currently practicing as the consultant dermatology at Sunrise Hospital, Kochi. Dr. Manju M has dedicated her career to diagnosing and treating a wide range of hair and skin conditions while providing personalized healthcare services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Manju has also aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Manju M, for sparing your valuable time to answer the question on hair care for us today. Welcome to this YouTube live show.
Thank you. Thank you, Mona, for the warm welcome. Thank you.
Dr. Marshall जुड़ने के लिए बहुत बहुत शुक्रिया. So today we are going to discuss about hair care in current scenario. And whenever we talk about hair care in current scenario, the first and the foremost question which and the common problem faced by all of us, irrespective of gender and age, is the hair fall. So can you enlighten us today with your profound experience? That is hair fall normal?
Sometimes hair fall can be normal. 100 to 150 hair shed per day is normal, absolutely normal. When the number increases, you have to be concerned about the hair fall.
Okay, so when
Our hair has got a hair cycle. So there's a growing phase and there's a shedding phase. So the growing phase is called anagen phase and the shedding phase is called telogen phase. So when we take at a particular point of time, 90% of the hairs will be in the anagen phase, but some will be in the shedding phase. That's the telogen phase. So that will shed normally. So 100 to 150 per day hair fall is normal.
Okay, so doctor, now that we know what's a hair fall and what's normal, so are there any alarm sign or something like which we can take a look of and we can like okay, it's time to visit the doctor. If we avoid this time, maybe the hair loss will be much more. So what like when to be concerned for and when should we visit to the doctor once we face this hair fall or hair loss?
Yes, when we notice the number increases more than this, like when we get up from bed, there's a lot of hair. So when we take shower, there's a lot of hair. If we notice something unusual, then we have to consult a skin doctor or dermatologist, and we have to check what is the cause of hair fall. The cause maybe there are different causes for hair fall, so we have to check that. Like the common ones I'll mention. The common ones are maybe due to nutritional deficiencies, like vitamin deficiency, any either micronutrients deficiency, hemoglobin deficiency, thyroid problem, or it may be due to other problems like hormonal, like the male and female pattern hair loss. That is the androgenic alopecia, or it may be telogen effluvium. That telogen effluvium means when we have a stressful event, it can be a mental stress or a physical stress. The physical stress can be viral infections like COVID, dengue, or like excessive dieting, excessive exercise, or any physical or mental trauma can trigger, like the hairs in the anagen, that's a growing phase, will convert to the shedding phase, and that will notice 2, 3, or 4 months after the event. So that is the telogen effluvium. That is another cause for hair fall, and certain type of hairstyles like very tight ponytail, a particular type of braiding. Everything can cause this hair fall, and our lifestyle can also has an impact on hair fall, and the certain hair treatments like keratin treatment or like excessive
Visual.
heat exposure, then everything can lead to hair fall. So first we have to find out what's the cause of hair fall, and then only we have to treat it. That's it.
Okay, quite interesting, doctor. So, doctor, like you're talking about the causes, and people keep like most of the people who are like having a family history of hair loss, they keep asking why me, why it is me. So, can you please elaborate more about like what are the general causes of hair loss apart from dietitian, like dietary or nutrition lack thing? Apart from this, what more are the reasons of this hair fall?
The main reason for hair fall nowadays is the male pattern and female pattern baldness. That is,
Mm-hmm.
for males, that may be due to the genetic predisposition, and sometimes the lifestyle can also add on to that.
Mm-hmm.
And the initial stages for males, the initial stages, there will be bitemporal recession, and then they notice the thinning of the central part. But
Mm-hmm.
for female, the hairline will be preserved. The frontal hairline will be preserved, and there will be a widening of the partition line, and then there will be the lows from the central part. So this one cause that hormonal type of hair loss.
Okay, okay. So hormonal imbalance and male female pattern, and these are the common thing of hair loss in both the genders. And doctor, you've been mentioning about lifestyle, that lifestyle play a major role in hair loss. So can you please enlighten us today, like because we all are like very busy, working late night, not eating on time. So can you please elaborate a little more, like can a person's lifestyle play a role in hair fall?
Yes, definitely. Lifestyle has got a very good role in maintaining the health of hair. Like if in nowadays there's a corporate setup in everybody under stress. The stress can lead to hair loss. The stress can affect the natural hair cycle, and it can lead to hair loss. And our unhealthy eating habits, like the junk food, that will lead to the nutrition deficiency. So
Mm,
then the lack of sleep, late
mm.
everybody is working late night, and so all these can add on to the hair loss.
Okay, okay. So, like healthy lifestyle is very important even for the
Yes.
hair health. Okay. So now that doctor, we know like what's hair fall is and what's normal and when to be concerned for. Another very common question which is asked by all of us is like, what are the medical treatment options available? Because like because of this era of the lot of information, we are quite confused. Like, what are the real medical treatment options available for hair fall? Like, is there any surgical, non-surgical, or is there any oral also which we can eat and manage our hair problems?
Yes, there are a lot of treatment options available, like topical treatments and the systemic treatment. But the first and foremost thing is we have to find out the cause. So, what's the cause of the hair fall? That's the main thing. So, if we
Mhm.
can address the cause, we can reduce the hair loss. So, the for topical treatments, like we have the topical applications like minoxidil and non-minoxidil preparations are available.
Mhm.
Minoxidil works better for the androgenic alopecia, that's the male pattern or female pattern baldness, and other non-minoxidil preparations are also available. So if you're planning to start minoxidil, so that's not a short-term plan. That
Mhm.
should be a long-term plan. You have to continue using minoxidil because we need 4 to 5 months to see the result of minoxidil, and we have to continue using the minoxidil. Then only we can sustain the effect of minoxidil. So then the other topical preparations like Procapil, and again then another preparations are also available that is useful for mainly for the telogen effluvium, and the oral tablets like oral supplements, nutrition supplements are also available, and another oral treatments like for androgenic alopecia we have treatments like oral finasteride. The finasteride will inhibit the conversion of the active, that will decrease the formation of the active testosterone levels in that is causing the conversion of the terminal hair into the thinner hair, that in case of androgenic alopecia. So other top oral finasteride is available, and other treatment options are also available, like hormonal treatment options are available. Like the first and foremost thing is we have to find out the cause, then only treat it.
Treated.
Okay.
Okay.
Then
Okay.
certain procedures are also available like PRP, that is the platelet-rich plasma therapy, and the growth factor concentrate therapy.
Mhm. Mhm.
Then ultimately we have the hair transplantation. If the in later stage of androgenic alopecia, you have to go for the uh, hair transplantation if all other options fail. That's it.
Okay. 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 So wide range of treatment is available based on the root cause. So it is important for us to go to the doctor and get the, cause of the problem and then take the right treatment options.
Yes. Nowadays, under the influence of social media, many are coming and asking, Doctor, I'm having hair fall, and can you do PRP? But they are,
Mhm.
yes, they are very much aware of the procedures. But
Mhm.
the main thing is we have to find out the cause. Then,
Cause.
if it is due to a vitamin D deficiency, just we can give supplements, and then the hair loss will be back normal.
Mhm.
So
Mhm.
first thing is mainly we have to address the cause, and then go for other treatments like the PRP and GFC. Okay.
Okay, okay, quite interesting, doctor. So, doctor, you talked about just nutrition supplement, and there is one word called nutraceuticals. It is getting a lot of focus nowadays. And can you please enlighten us, like, what is this nutraceutical and what is the role of this nutraceutical in hair health?
Yeah, the nutraceuticals are the nutrition supplements. Nutrition
Mm-hmm.
supplements. If you're suspecting, if your diet lack of the nutrient intake, you can go for you can take the nutraceuticals. These are just the dietary supplements like the that contain the micronutrients and the vitamins according to the RD recommendation. That's a recommended dietary allowance. Okay.
Okay. Mm-hmm. Okay, so these nutraceuticals can be helpful in managing hair loss. So, doctor,
Yes.
another like we you talked about the diet and nutrition play a very important in hair fall. So, what are the some of the vitamins which are used in managing hair loss or alopecia?
When a person come with hair loss, and usually we do vitamin D test and the vitamin B12. The
Mm-hmm.
vitamin B12 deficiency mainly for the vegetarians, but some
Mm-hmm.
non-vegetarians also experience the vitamin B12 deficiency.
Mm-hmm.
And then we check for the then other like hemoglobin level and the ferritin level. Mainly the vitamins we check the vitamin D level and vitamin B12, the like folic acid and biotin, certain other vitamins also add to the role, and usually we check the mainly vitamin D and vitamin B12.
Okay, so main is the vitamin B and vitamin B12, which is important for hair growth. So, doctor, they like there are so many vitamins and then there are minerals also. Like, what is the difference between vitamins and minerals? And some of the minerals like iron and zinc, copper, do they promote hair growth? Because there are so many information that said that okay, this will promote the hair growth.
Yes, definitely. Iron has got a very good role in promoting maintaining the natural hair cycle,
Mhm.
and uh, the hair for the hair follicle integrity we need iron,
Mhm.
and then we need the zinc also for the hair follicle integrity. Then the copper is mainly for the increasing the blood circulation to the scalp, and the
Mhm.
actually our diet should be rich in all the vitamins and the micronutrients, and the main thing is we
Mhm.
need a balanced diet for
Mhm.
maintaining the good hair and the good skin. We need a balanced diet that include
Mhm.
all the like the main the fruits, vegetables,
Mhm.
and protein intake. That is very important for the hair, for maintaining the integrity of hair, and also the adequate water intake.
Mhm.
That's all. Everything is the main thing is we have to maintain a balanced diet. Iron, copper, everything is needed for the hair.
Mhm. Okay. So, like a balanced diet is very important to have those all vitamins and minerals in our plate and have a good hair and good health. So, doctor, like you said that these supplements need to be taken as per the requirements. So, like there's another very common question, like is it required to take these nutrients as per gender RDA requirement or under the supervision of a doctor? Because nowadays so many people are like, yeah, buy this, there are a lot of gummies also. We pop it and we think that okay, maybe the hair will grow and we'll get the hair back. So is it required to take these nutrients as per RD requirement or under the supervision of a doctor, or is it okay we buy it and just take it blindly?
No, we can take the this micronutrients according to the recommended dietary allowance. Okay,
Hmm.
that is a good thing. We have to take nowadays a lot of hair gummies are available.
Yeah.
So that may not contain the nutrients according to the recommended dietary allowance,
Hmm.
or that contain more sugar. That's not needed. Some of the hair gummies contain more sugar, and that's not needed for our body. So it's better to consult a doctor, and then if needed, you can take the dietary supplements. Okay, because as I mentioned, the all cause of hair loss not due to the micronutrient deficiency. If needed, you can take the micronutrients. In some cases, maybe due to androgenic alopecia or telogen effluvium. We have to find out the cause. That
Okay, okay. So according to the root cause, we need to take these supplements, not like buying it by ourselves and spending a
yes,
lot of money.
not for everyone. The supplements are not for everyone.
Mhm. Okay. Quite interesting, doctor. So, doctor, like we talked about lifestyle, and in lifestyle, there is one thing which is unavoidable by all of us is the stress. And nowadays, we are all stressed for any like everything somehow. So, is there any impact of stress in our hair health?
Yes, the stress directly affect the hair cycle.
Mm-hmm.
Okay. Then, as I mentioned earlier, our hair has got the growing phase and the shedding phase. Due to the impact of stress, the hairs in the growing phase will convert to the shedding phase, and we notice the shedding of hair 2, 3, or 4 months after the stressful event. That's it. Or if there is a constant stress that will lead to the daily loss of hair.
Mm. So, it is important to manage the stress so that
Yes, yes.
yeah, okay, okay. And once the stress phase is gone, then the normal hair fall will not be there, right?
Not like that. In some case of telogen effluvium, the hair can grow back gradually. Normally, without any treatment, it can grow back. Sometimes the hair will grow back.
Okay. No, you're quite interesting, doctor. So, doctor, when we are stressful, the very common formula which is given by all the mothers are like the oil massage. They say that if you take the oil massage, the stress will also go, and if you apply a lot of oil on your scalp, you'll get a stronger and thicker hair. So, what do you think? Like, what's the fact behind this? Oiling hair is a boon or a ban?
Oiling hair, it has got good effects. Like the oiling will give you that will give moisturization to our hair strands. But
Mhm.
oiling directly of the scalp, it can increase. And then when you apply oil and you massage, then the blood circulation to the scalp increases, and sometimes it can lead to a little bit hair growth. That's it. But it can't address the cause for hair fall.
Mhm.
Like only that will give a massage. When you apply
Mhm.
oil and leave it alone, it won't produce anything. Like only the moisturization. When you massage, there will be some blood flow increases, and a little bit we can that. Not or if you are having dandruff and you apply oil, it can lead to worsening of your dandruff.
Okay, okay. Okay,
For
so thinking that
moisturization, oil is okay. If you're using oil for moisturization of the hair strands, then that's okay.
okay, so for conditioning is okay, but if you are thinking that applying it and sleeping it for a overnight and getting up early and have a long hair is not true, it's a
Yes,
myth.
yes.
Okay.
And one thing, if you're applying oil, you have to wash it off with shampoo.
Okay.
And otherwise, if you're having oily scalp or if you're having dandruff, that will lead to worsening of the problem. You can apply oil 15 to 20 minutes before the bath, and you have to wash it with shampoo.
Mm-hmm.
And it won't produce much effect on the hair growth. Just a massaging effect can help. That's it.
Yeah. Okay. Quite interesting. So like apply oil and then wash it out. Do not keep it for overnight.
Yes, yes.
Okay. Okay. So now, doctor, my favorite part. Can you give us some important tips for healthy hair today?
Yes, I have mentioned everything like healthy lifestyle is needed, balanced diet, like balanced diet, stress-free life, then adequate exercise is needed, and like other things like mainly the balanced diet that comes everything we have to include everything, adequate water intake, adequate protein intake, adequate nutrition intake, then.
Mhm. Okay. So a balanced
And
lifestyle is.
one thing I'll add, we can wash our hair. That is not a thing that when we wash today and we are not washing tomorrow, and so we notice that when we wash, there is a lot of hair loss. That's not related to the hair wash, and hair loss not related. If you are
Mhm.
using hot water, it can make your hair frizzy, but it
Mhm.
won't lead to the hair fall because
Okay.
already shaded hairs are lost when we
Mhm.
wash the scalp. That's it. You can wash the scalp
Mhm.
according to your comfort zone.
Okay, so the hair wash doesn't lead to hair loss.
Yes,
Yeah, so
yes.
people who are like actually people who are like scared of hair loss or they are already facing hair loss, they do not wash their hair thinking that okay, if I wash
Yes.
my hair, it will. Okay,
Okay.
quite interesting. So doctor, there is one more confusion about like people are my like people me and many of the common people, and because of so many information on social media and also like while traveling we see a lot of posters like come to us, we'll provide you full hair growth. So like people do not know like whom to consult, so like whom to consult for hair problems is MBBS physician or and there are also like many dermatologists and trichology. So who are the like the right person whom to consult for hair problems?
You can consult a dermatologist or trichologist. The dermatologist who are specialized in trichology, and dermatologist are skin, hair, and nail experts. You can consult a dermatologist.
Okay, no, not MBBS, not physician. It is dermatologist who is the right person to consult. Okay, quite
Can't say that. Dermatologists skin, hair, and nail experts. You can consult him, or you can consult the physician.
okay. Because nowadays even the saloon guys are like give the consultation. So people, according to their consultation, they take the therapies and then they cry and spend a lot of money and a lot of problems are there. Anyways, doctor, there like also one another problem like question is this like there are so many products available on this social media, Instagram, and there are so many people saying that take this and you can get full hair growth. So are the are these supplement or are the products which are available, are they really useful?
Like all these depends on the cause of your hair fall. If your hair fall is due to androgenic alopecia, that's a baldness, the male or female pattern baldness,
Mm-hmm.
no supplements will help. We have to treat the underlying cause. If your hair fall is due to a nutrient deficiency, then the supplements can help. That's it. And the supplements should contain the vitamins and the minerals according to the recommended dietary allowance.
Oh, okay, okay. So according to the root cause and according to the dietary allowance, we can take these products and may be helpful for hair growth. Okay. So this discussion was very informative, doctor. I'm sure our viewers have found the session very helpful. So can we take some live audience question?
Okay.
Yeah, so first question from our audience is, hi, Dr. Manju. I'm also from Kochi and I want to take your appointment because I'm facing androgenic alopecia. I have been taking a lot of vitamins and minerals, but I can't see any hair growth. Can you help me, please?
Yes, for androgenic alopecia, we don't need the vitamins and minerals. We have to address the underlying cause. Like, according to the stage, androgenic alopecia has got different stages. If it is an
Mm.
early stage, even the topical minoxidil application can help.
Mm.
Uh, According to the stage of androgenic alopecia, we manage.
Okay, according to the stage of androgenic
Stage of
alopecia.
alopecia.
And how to get your appointment? Can he find you on Google?
You can take appointment from the
Sunlight
Sunrise
Hospital.
Hospital.
Okay. Another question from our viewers is, hi doctor, 2 years back I got a burn scar on my side and it's looked very ugly. I've been trying everything to get my hair back, but nothing is working. What should I do? Can you please help me?
Pardon, can you repeat the question?
He got a burn accident, and due to that he got a scar on his side head, and
Okay.
on that scar the hair is not growing back, and he's been trying everything but no hair back.
Okay. If it is a burn scar, it can damage the hair follicles. So over
Oh,
that, the hair won't grow. So first, we have to see what type of scar, and if needed, some other treatment options like transplantation and another options may be needed. With only topical application over the scar, the hair won't grow back.
and also all these products like nutrition supplement, they won't work for him. Okay.
No, 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 no. The nutrition supplements would work for the scar.
Okay. Mm. Okay, I'm interesting, doctor. Hi, doctor. I'm a diabetic patient and I'm 52 years old. I have a C grade bald patchy hair. I want to go for a hair transplant. Can I go for hair transplant even if I'm diabetic?
52. He's 52-year-old, no?
Yeah.
52-year-old for what? For androgenic alopecia. He's
Yeah, C grade ball.
okay, okay. Age is also a factor. So you have to check with your plastic surgeon or the head transplant surgeon whether he can do that. Like age is also a factor.
Mhm.
And
Okay.
diabetic, according to, during the time of the procedure, your sugar level should be controlled. Better to discuss with the concerned plastic surgeon or the transplant surgeon.
Oh, okay. So consultation, like with the help of the doctor, he can go for the transplant. It
Yes.
depends on his case. Okay. I'll quickly take the last question because we are running out of time. Hi,
Okay.
doctor. I'm at a menopausal stage. My age is 50 years and I've been facing a lot of hair fall. My neighbor told me that if I take hormone therapy, my hair will grow back. So, can I take, and do you do hair hormone therapy?
For the main thing is we have to find out the stage of if it is a stage of alopecia, like if it is a female pattern hair loss, which stage she is in. That if
Hmm.
needed, if all other treatment modalities fail, she can try. Otherwise, there are a lot of treatment options available. Like even with topical treatment, we get the result, or if
Hmm.
needed, we can add the procedures. So only the topical treatments and the other things fail, we can think of the systemic treatment.
Mhm. Okay. So, but like women go for so many changes, hormonal changes in their life, like whole phase of life, like PMS, menopausal. So, is this hair fall is normal, or and for this kind of hormone changes, do we need to meet the doctor, or is it like with time it will go away automatically?
No, like if sometimes females develop the female pattern baldness nearing the menopause. If
Okay.
that is the cause of your hair fall, you have to treat it. Yes, you even with topical, like if it is an early stage, even with topical minoxidil, we see the results. So
Mhm.
that the choice is actually depends on the patient. If they want, they can treat it. Okay.
Mhm. So
There are a
it's
lot of
better.
treatment options that are available. There are a lot of treatment options are available for hair fall. So the yeah to vary the treatment options vary from person to person.
Mm. So spending money on these product, buying these products and applying so many things on our for a head, it's better to visit the doctor, right? And
Yes, it's better to visit a doctor and find out your cause of hair fall. Otherwise, if you spend lot of money and if you're applying very many serums and you are taking many nutrition supplements, then there won't be any result. That's it.
yeah,
Even
we'll
with
be
a
already
simple,
tired.
yes, even with simple topical treatments, you will get the result in some cases.
Okay, so it's always better to visit the doctor, not become our own doctor. Hmm. Okay, so doctor, finally, would you like to give any take-home message or any other suggestion to our viewers today?
My take home message is you have to maintain a healthy lifestyle for your hair and your skin. That's okay. If needed, and don't hesitate and don't treat yourself, just consult a doctor and find out what's your cause of hair fall and then treat accordingly.
Okay, so healthy lifestyle and early intervention with the help of the doctor is the key for a good hair and good healthy hair. Okay, thank you so much, doctor, for sharing so much of information and all your expertise with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very helpful and beneficial. Thank you, doctor. It was a delight to have you, and thank you so much for your valuable time.
Thank you. Thank you so much.
Thank you, ladies and gentlemen, for joining us today and asking so many questions with us, with our doctor today. We'll again take an appointment with our doctor with some new topic about his skin and hair care, and we'll cover all the rest of the questions which I could not cover today. Thank you so much, doctor, and thank you so much for your time. Let's sign off for today. Have a
Thank you.
nice. Bye bye.
Thank you.